Is now declared a public health emergency in the United States, but Kentuckiana doctors say they're still more concerned about COVID-19.
WDRB's Darby Bean explains their message to the community.
The federal government declaring a public health emergency this week related to the response of the monkeypox outbreak. Louisville's health department hoping that will mean more resources coming to the local level.
I think the bottom line is we're all glad that our federal partners have decided to make this an emergency. They've acknowledged that we have an outbreak in this country and that people need to pay attention to it.
Louisville's interim public health director says across the country, including here, there's a need for more vaccine. And with hundreds of doses expected to arrive in the city soon, there's already a plan for allocation.
I just held a roundtable with some of our LGBTQ plus community because they are at the highest risk for this illness. And they've told me we want vaccine. And so we're doing everything in our power to get more vaccine here. We're advocating hard for the Louisville community to get more vaccine.
According to the CDC, there are more than 7,000 confirmed cases in the United States. Monkeypox symptoms include things like a fever, headache, muscle aches, swollen lymph nodes, chills, exhaustion, and respiratory symptoms. Doctors say one of the biggest signs is a rash that can look like pimples or blisters.
These will open up and weep, and contact with the substance that weeps from these wounds can actually spread the virus.
At least 6 cases have been confirmed in the Jefferson County area, but the health department believes there could be more. Across the river in Clark County, Indiana, the health department knows of 1 case. And while they want the public to be aware, they don't want this to cause fear.
I think all of us are still a little scarred by the pandemic and, what an issue that became. This does not appear like it's going to be anything approaching that same level.
For the most part, monkeypox is a minor illness. Most people will get get the rash, they will feel bad, but and the fatality rate's extraordinarily low.
Doctors say if you think you have monkeypox or if you're a close contact to someone who has tested positive, it's a good idea to give your healthcare provider a call. Darby Bean, WDRB News.
This is how monkeypox spreads according to the CDC. Close personal skin-to-skin contact or intimate contact, direct contact with rashes, scabs, or body fluids from someone with monkeypox, or touching objects and surfaces that have been used by someone with monkeypox.